Managing risk is critical in modern mental health care. Information reduces that risk for everyone: patients, staff, and the wider community. Every trust will have to use electronic patient records. This is the future for mental health care. And modern progressive trusts across the UK and North America, including Cardiff and Vale, have taken a leap into that future, placing the patient at the centre of everything they do. The resulting clinical systems are informed, responsive, and wholly integrated.
What we wanted, I think what you need is a system, an IT system that can fit the way in which you work, rather than the alternative.
The main advantage of having the Paris system, in my opinion, is to do with patient safety, and I think that's because we can do more accurate assessments of patients, particularly out of hours.
The key benefit we've identified and seen through the implementation of Paris is that it is so malleable. It is a Meccano set in terms of its technology, and you can put it together to do whatever you may need in a health environment.
I think if you're a client and you're turning up and you're seeing somebody that's new and you're in crisis, the last thing that you want to do is to have to go through all of your life's history, some of which may be extremely traumatic, with a new individual. You're more than likely to be happy for that information to be read by the new assessor, but actually having to divulge it all again, it may take an hour or longer to do that. With an IT system like Paris, you don't have to do that.
For years, Cardiff, like many other trusts, had been managing in a virtually information-free environment. The system they now use is a pioneering one, unique in its clinical approach. And it's paying off because everyone's using it. Compliance has gone up to 98%, and teams are able to see the system making a real difference.
It would be quite possible in the past for patients to have presented on a number of occasions in the months before, and they might be in a psychological state at the time where they don't really tell you that for whatever reason, or it's not apparent. And you would immediately know that on these dates this patient was seen and this is what they were like, and you can see a story or a situation developing.
A young staff nurse said that in 6 years working in the community, since using the Paris system, she now felt safe coming to work for the first time ever. And that's purely because she knew that in any instance she would have access to risk information at any time.
The fact also that they're able to walk away with a printed copy of their care plan, because it's very easy to print that off the system, means that they can get involved. They're not having treatment done to them, they're actually participating in treatment as well. So I think that aspect of the system is very good.
The key byproduct of it is that the service is able to manage itself and commission itself and see its future in a far clearer picture, because it knows what it does now.
Prior to the system, it was very much sort of gut instinct. Should I go alone or should I take somebody else? Whereas I feel you're a bit more informed now prior to making those decisions. So I feel safer as a clinician visiting people at home.
I think from a team perspective it feels safe in that the whole process within the CMHT is managed through one system and one process. It's not this person's job to deal with that part of it. The electronic system picks up from the time we receive the referral and it's logged onto the record, right through to the discussion in the multidisciplinary team meeting, to the allocation of that piece of work, to the feedback from the initial assessment, to deciding on the outcome then, is all recorded through one system that the electronic health record gives us. You can't fault that process.